How y'all doing?
Good.
All right, I'm going to start by introducing myself. My name is Jameelah, and I am a registered nurse working at 2 emergency rooms. I'm going to have everybody introduce themselves, and then we can go through backgrounds and what people do.
Okay.
Where do you want to start?
I'm gonna go first. Hello, I'm Ebony. This is my background.
Yeah, what do you do? What are you? What do you do?
I have several names.
Okay.
Artist, mother, daughter,
Okay.
community activist.
All right. Okay.
From here.
Okay. Work with children. You still in school?
Children. Yeah.
You still at the school?
I'm sorry.
Still at the school?
I'm still at the school. Still there.
I think about you often.
Yeah. This year was pretty good.
Has it been? It's been
That's
better.
why I'm still
There.
there. Yeah.
Alrighty. Okay. Next.
Hi, I'm Alexa. I'd like to meet you guys. I also wear a lot of hats. I am also an artist, teaching artist. I work with some different programs, teaching kids drama programs, theater, directing, acting, singing, all of that. I also work for various fitness companies doing like social media management and stuff like that. So lots of hats. Yeah.
Okay.
I am Miranda. I wear many hats too, but I like to think of myself as daughter, mother, artist, teacher, educator. So that's what I do. Make a living as a teacher, but I make a lot of art and make me happy. So glad to be here.
I'm a gardener,
Alright.
medical social work,
Okay.
and mother and grandmother.
You got somebody creeping in? Hello. Come on in. Come sit down.
Was she finished?
Yeah.
Yes, she's finished.
Very short.
Hi, Rosalind. Mother, line dance teacher,
Okay.
union activist, vice president.
Okay.
Okay. Behind the camera.
Gloria, gardener, mother.
Okay. Organizer.
Organizer. Yeah.
The reason that we're here.
Yeah.
Right. Okay.
Mhm.
And this is my assistant.
Yes. I'm Samaya. So my main hat that I'm wearing today is daughter and assistant. But I'm also a teaching artist as well, specializing in drama. I'm a artist, a theater practitioner. I also work part-time at one of the hospitals that she works at in the emergency room as a secretary. So kind of bridge, I feel like we're all kind of bridging each other here today with what we all do, what we all bring.
Again, I'm Jameelah. I'm an emergency room nurse, a gardener, an activist, an artist. I paint. Haven't sewn in a while, but I sew. I do puzzles, crossword puzzles. Sudoku is one of my biggest things. I like coloring. And I am a mother, a daughter, a sister, a friend, and I guess a life coach to some. Yeah. And this is our health workshop. This is year 3?
Yeah, like 3.
Year 3. Typically I come and talk about 3 particular things. Chronic illnesses and how to manage those things. Advocating for yourself in the healthcare system. Particularly as it relates to where you should. Okay. All right. Okay, get that other card. Blue over there. But particularly as it relates to where you should go, right? Primary care versus emergency room, things of that nature. Also, I usually talk about medications and how most of us, if we have chronic illnesses, we are taking multiple medications and how to manage that. Like a lot of them may have the same symptoms and stuff like that. This year I wanted to do something a little bit different, a little more fun. So I have a few games that kind of touches on those things in a different way, in a more artful, creative, and dramatic way. How I think I want to do it is, first I want to go around and I want everybody to ask, like, what's a question, what's a healthcare question that's like, it sticks in your mind, you always want to ask, you never seem to get a good answer to. I don't know if I'll be able to give a good answer, but but I'll try. I also want to preface that I am a nurse, I am not a doctor, right? You take what I say with a grain of salt, it's just information. It's just information, I have to say that. I am not a practitioner of medicine, so I have to be careful of how I give information. So I am sharing freely what I know, what I've learned from my schooling, and it doesn't go past that. So since you raised your hand first, what's your name again? I'm sorry.
Rosalind.
Rosalind. Go ahead, Rosalind. What's your question?
Okay, so I've been on and off high blood pressure medicine for years.
Okay.
I was very proud when I went off, and I don't quite remember what got me off.
Okay.
But now that I'm back on, of course my dosage is higher,
Mm-hmm.
and I just want to get off it.
You want to be off of the high blood
And that's
pressure
the
medication.
only, besides my weight, that's the only thing
Okay.
that I take medication for. I
Okay.
don't even take medication for my weight.
Okay.
I just try to do it as best
As best you
manage it
can.
as best I
Okay.
can. I would like to get off of high blood pressure medicine, period.
I absolutely understand why you would want to get off of high blood pressure medication. I know it has a lot of side effects and stuff. The main thing about medication and managing your health, honestly, is lifestyle change. I struggle with it. It's, you gotta lose some of the weight. You lose some of the weight, you will probably maybe not completely get off, but lower dose. Your blood pressure will manage. That's part of the way we eat, what we eat. So even if you can't lose weight tomorrow, but maybe what you're eating, right? Think about how, when are times your blood pressure is a little bit higher. You know what I mean? Managing our cravings. I eat really, really good, and then I eat really, really bad. So that's the best answer. It's always going to be lifestyle changes. That's always going to be the answer. Yeah. Anybody else?
I have one, but
Mm-hmm.
you already gave your disclosure. What impact does different medications prescribed
Mm-hmm.
for various conditions have on your liver?
Well, they can have a big impact, they can have a little impact. So the way medications work is how they metabolize through your system. So some are metabolized through the kidneys, some are metabolized through the liver. And so it just depends on how much and how long. That's why doctors want to do blood work. That's why preventative care is so important, going to the doctors every 3 months, every 6 months. That's why blood work is so important, because that's going to show any changes, and the doctors should be able to figure out, okay, all right, her liver function is off, right? What meds is she on that could potentially affect that? That's the idea. But that goes back into advocating for yourself and asking those questions. Asking your doctor, this medication that I'm taking, I know you want me to take this for X, Y, and Z. How does this affect my organs long term? Right? Those are questions we don't really know to ask, and we're not really sure what type of answer we're going to get. But just be straight. How is this going to affect my body? Right? What type of, I know I don't look at the whole pamphlet that the pharmacist gives me. I don't look at that. So you'll never know what side effects am I to expect, right? And how long should they last? right? Some medications that are gonna make you dizzy for 3 weeks before it levels you out, and then it won't have that effect ever again. But you don't know that, and a lot of times you don't. Doctors may not tell you that; they just may give it to you. So you do have to really be diligent about like saying, how is this going to affect me? Anybody else? We got a newcomer? I remember you. Hi, introduce yourself.
How you doing?
All right.
My name is James McFadden, and I'm one of the founders of the garden here in Involved. I live on the corner of 26 Thompson Street, and I've been living there for over 50 years.
Awesome.
And I've been trying to help our community. Lost my wife a year and a half or so ago. And, it's taken some adjustment. So God
Yeah.
is a good God.
Absolutely.
He brings us through all the time. And, I'm excited about the garden. I'm sorry I was a little bit late, but I tried to get out of the church as soon as I could. But our church burned 3 months ago.
Oh, wow.
And we have to wish about another church now, but you coming, it's coming together.
Okay.
And I'm just glad to be here. I
All right.
apologize for being late.
Oh, no worries, no worries. I'm glad you made it. I'm glad you're here. We just a recap. I just reintroduced myself, Jameelah, nurse, and we were just going around pulling out questions that we might want to ask a doctor, or we just never seem to have a good answer to, get a good answer to. So if you have anything that you might want to ask, maybe I can help put some understanding.
I have a number of questions based on the period that we're living in. It seems to be so scary. It doesn't seem like there's any great concern for elders and children. And these are the two segments of the community that seem to be very, very important. But we some ways we're prepared for it. We've been told that people who are really aware will help take care of children and the elderly. So I feel confident with that. But one of the questions that I have that I think is extremely important, how do you suggest that we move through this period in terms of seeing our physician and first one thing and then another?
That's a good question. That's a deep question. That's something that I ask myself daily, especially being in the forefront of the healthcare in the emergency room is something that I'm kind of passionate and concerned about myself. And I don't know what people's faith levels and faith spaces are, but I say stay prayed up. I'm gonna be. That's the only, and that's a spiritual health question. As I say, stay prayed up. I'm not sure. I think with a lot of what's moving on and different laws, different bills, different things being put in place, I don't know. I'm curious to see how it affects the health system at large, how it affects the elderly, how it affects children, how it affects. I work in Kensington, so I work in a large population of homeless, mentally ill, and addicts. That's 99% of the population of people that I service. And I see how in some ways they are treated, and not so much is wrong. I'm curious as how it is going to affect them when people have less health care, and you know what I mean. That's a touchy place for me. I say stay prayed up because the weaker of our community is going to suffer. That's what I think, unfortunately. And I think it's going to take the community. I think it's going to have to really go back to a grassroots type of mentality where people in the community are knocking on houses, feeding kids, like the way I grew up, like the stuff that doesn't exist, like closing off the blocks during the summertime and making sure that people eat, making sure that, you know, Mr. Smith down the way, his windows is not shut in the heat. Like, it's really gonna, like, I think it's forcing us to kind of get back into like a more grassroots community way of thinking. I think that's ultimately my answer.
I think you're right. I'll be 86 years old in a couple of weeks.
Wow.
And
Yeah, that's
I believe that we do have to utilize some different forces. I've had an opportunity to participate in many aspects of our society, so I've seen it.
Mhm.
I've seen it go what sometimes seems to be rock bottom, as high as it can go, and at the same time, it's been very problematic. But one of the things I do believe, I remember when Congressman John Lewis was in office, he was saying something to the effect that we have to fight a good fight. This is not a time that we can really get depressed, that we gotta find ways to do something.
sorry.
That's-
Oh. I'm sorry. I know some people who just want to.
That's okay. We'll give them time to
We give them time.
give their seat and
Mhm.
everything. That'll be important.
Alrighty. There's a sign-in sheet up here. Okay.
It's not about, it is about myself, but
Okay.
my parents are aging,
Mhm.
and they live at home, and because I don't live close by, sometimes I feel powerless when things go wrong, and they have, like, they've had life-threatening illnesses
Mhm.
and gone through surgery and recovered, and so I guess in your experience as a nurse, watching families in crisis, you know, try to support their parents, do you have some words to live by that would be good advice for, you know, a child of aging parents? Like, where do you see, like, me helping my parents best? Like, and, like, how can I help
How
them
can you help
the best
them?
without, but also allow them to make their own choices and live their life as they
I think so I can come from this from two places. One, losing my mother fairly early. And I say early, she was 61. And right after that, I lost my grandfather, who was 80-something years old. And as a nurse. In the medical world, we have like a saying that speaks to quality over quantity. I am a big quality over quantity person in my personal life and in my healthcare journey as a nurse, right? I want to give my patients and the experience of quality. I don't know how long they have. I don't know how long they're going to be with me. As far as in the ER, sometimes they're with me for 15 minutes. Sometimes they're with me for my entire shift. But my goal is quality time, right? Taking care of what they need. So as a caregiver of parents, that's where you have to think in, right? What is the best quality for them? Not for you, but for them, right? Quality for you might be like, yeah, I need to know everything you're doing, and I need it, but that may not be what's quality for them. Honoring those things, I think, helps to process when they want to do things that you don't necessarily agree with, and even how you could navigate talking to them because it's coming from a place of I really want you to be okay, right?
Yeah.
Not me. And it is a hard balance, right? It's a hard balance. So I don't know if that answered the question.
That actually really helps because, yeah, it's like, but having that in my head, I think will really help me because it'll help me communicate better with them.
Absolutely.
And
Absolutely.
respect their life and their
Absolutely.
choices. And, yeah.
Absolutely.
Yeah.
Okay, we're doing sidebar. We got a few new people that didn't get introductions. You, you, the whole table is new. Oh, and
I was James. I'm here. I was invited by my uncle.
okay. Alrighty.
Was there anything else I wanted?
You're supposed to say
Who
what you
are,
do.
how many hats you wear, what do you do, what's your connection to the garden?
Yeah, so this is my only hat.
Okay.
I'm also a biomedical scientist. I'm also an organizer. I'm pretty much agriculturalist. I kind of mix and dip and dabble in a lot of things.
Okay.
But the majority of my work is in science.
Okay.
Specifically infectious disease. So
Oh,
that's
awesome. Oh, great. Alright.
That's it.
Next.
My name is Sheree. I work as a support worker. I work as a nurse. I'm a mom. I'm a wife. I'm a student. I'm also aspiring. I guess holistic type thing. Like I want to be more into healing, herbal remedies. These are my kids. And this is my husband.
You know. What do you do for a living? What hats do you wear? You're a husband, you're a father, and
As a father, organizer, not in bioscience though.
okay.
I followed the holistic thing like 8 years ago. Like I followed Sebi for like 6 or 7
Okay.
years.
Awesome. Okay.
I'm heavy into this, but I'm just here to support her.
Okay.
But
All right. I like it. However we get you here. And I'm Jameelah. I don't know if we officially have met. I know you too. And I'm a nurse. Me and Sheree work together. I'm so happy to see her. And
my name is Florence Page, Glory Mom.
yes.
I'm a caregiver.
Okay, that's it. That's all. Caregiver. That's it. That's all. So what we were doing, we were just going around, just throwing out questions. I have a couple of games, so I wanted to get that kind of question and answer segment out of the way because once we start playing games, we'll have fun. We'll move around a little bit and go from there. Anybody else have any questions? No? Let's do the medical table first. So how many people we got? We got enough people to break up into 2 or 3 teams. Yeah?
Mm-hmm.
Okay. All right, we're gonna do the old-fashioned way. 1, 2, 1, 2. 1, 2, 3. Let's do that. 1, 2, 3. 1, 2, 3. 1, 2, 3. Nothing. 1, 2, 3. Mike, you playing? Yeah, you walked in. 3. So all the ones come down here. 2's on this table, 3's at the bench. How many people we got? 1s, 2s, and 3s.
You need help.
$18 divided by 3. 6 apiece.
My bad. We can just be the ones.
But I've got a couple of
Okay.
and I've got peppermint growing in my pots in front. I had to move things to
Jameelah, this
yeah, I had to move bunches of
one.
stuff in the back.
What happened to all the ones?
What happened to all the
In
ones?
the backyard this
Who else is a one?
one.
Mom, what's your number? Are you a one?
You're a one. You're a one.
So
No, she's one.
She's a one.
Cause she was over here. She won.
Mom, come over here. You won.
Come hang out with us.
So Mike was a one as well.
Yeah, Michael, come over here.
So it should be 4. Alright, so everybody got it? One of them. There might be a couple extras. We'll go through. So how many people have played Taboo?
Never.
Okay. Huh? Yeah, okay. So the idea of Taboo is that on the card there is a thing. So let's say on the top of the card is a chair. But there's 4 words on the card that you cannot say in trying to describe a chair. So you can't say legs, you can't say arm, maybe arms, you can't say sit, so there's certain words that you can't say. So on your cards, grab a card. Right? You have to get your team to guess that bold word without saying the 4 words on the card. It might be easy somebody, but some might be hard. Remember, you can't slip up and say the word. 'Cause to describe it, you might think it's easy, but then you gotta go around and say play with the words.
can you say traits?
Not if it includes one of those 4 words.
But you can't say a phrase.
Whole word. You can't say any other word.
Okay.
So, no, it's not charade. It's taboo word on the things. These are pretty easy with the timer. We're gonna do, we'll try to do 2 good rounds, okay? And the other thing is each team, each round, you gotta try to get as many as you can in that time frame. So, for instance, team 1 is gonna go first, right? We're gonna put a minute on. Everybody has 1 card, and then if it's some extra, what is it? How long is the timer in the table? I don't know. A minute and a half. So once you guess it, then you move on to the next person who has a card, and then you go through your things. We'll be the timekeeper, and we'll make sure you don't say the taboo word. When you're all done, then it'll be team 2 and team 3. If in fact you guys know what they're talking about, once they're done, I'll give you an opportunity to guess what that was.
Would you give us an example of how this works? How it works?
We have 2 extras over here. I know, I don't want to give it away. I want y'all to get all the your cards.
No, I got mine. That's one on the floor. Brown.
No, turn all the cards. Turn all the cards over. You can't see the cards. Only yours. Only the one you got in your hand. Okay. Yeah. This is rough. Wait a minute. I Did you get that? You missed it.
I haven't done it yet.
So group. I'm trying to get you to describe something. Group,
Or guess what she
mouth.
described.
What am I thinking of?
It's medical. It's a medical. Right. All this is medically related.
Yeah. Flaccid. Limp.
And that's indicating what?
That's what you gotta figure out. The main word. You gotta figure out the main word that I'm trying to get you to figure out.
It's not on the paper.
Thank you.
Alright. So the word was stroke. Okay. Alrighty. And we're gonna do a minute and a half, and we're gonna start with group one. Alrighty. And who's going first? You going first? Okay. Okay. Alrighty. And go. Go.
Okay, left hand tightness. You need an EKG.
Heart attack.
Let me see. Was it on here?
Nope.
Oh, you did good. Okay. Next.
So I can't say
Don't say none of them words. Nope.
I can say a phrase or no.
As long as it's not on there.
Can't breathe.
Asthma attack.
Something in my throat.
Choking.
Yeah.
Okay. That's 2 points. Okay. Next.
Confused.
Amnesia.
Crazy.
There's so many things.
Huh? You gotta hold it. You said that. Hold it.
Anxiety.
That's on there. Buzz. That's on there. Next.
Mood swing.
Oh.
You lost.
You lost. Next.
Okay, so doctor. Once a year sometimes.
Physical.
Maybe a few times a year because of your situation, medical situation.
Time. So they got two.
Mine was
Does anybody know what the two things they were attempting to describe?
What's your physical exam?
No. Nope. And nope. Mental health was the first one. Mental health. What was the other one? You couldn't hear? Okay. It was.
I don't know.
It was preventative care.
Oh.
Physical.
Mm-hmm. Alrighty. All right. Next group. Who's going first?
Yes.
Okay. Start.
Set, go.
Okay, this is a particular part of the respiratory system when it acts up, and it's hard for you to consume oxygen.
Oh, okay, Miranda.
So say you cut your arm and then you go to get treatment. There's a place that you go to get treatment. If you cut your arm, urgent care, yes.
Go ahead. Good job. Go ahead. 2.
Necessary for healing.
Eating?
8 to 10 hours.
Sleep. Okay.
Broken.
Okay, can I go? Okay. All right.
Go ahead. But y'all got more.
Oh, okay. So when you do this when like you're doing a physical activity and you move it in a particular direction that's not normal. You
physical therapy?
Yes.
Go ahead, Miranda.
What you say?
Y'all still got more time. Y'all still got more time.
Can we do yours? Is there another one?
Oh, those
I
are
have
guys.
it.
She has one.
So this is somewhere that you call if you see someone get shot.
911.
Yes.
Oh, cool.
All right. That's time. That's time. Okay.
Oh, okay.
So 5, 2, and 5. Go ahead. Okay. All right.
Good job.
I know. All righty. Who's going first? Okay.
So you gotta just flip it, right?
Just flip the card and describe that without saying these.
Tom starts.
Ready, set,
Jumping jacks, push-ups.
go.
Go ahead. Do it. You want? Okay. You gonna go? He gonna go? Okay. That's a way.
The sun is on you. The sun is on you. It's like, ouch. It's too much.
Sunburn. Tammy.
She had it right. Do you know her personally? You know where she work at?
Good job. I got more. Oh,
Holistic. Don't. How did I say
Game
this?
night, Sheree. Game night.
You gotta,
Game night.
make. Can't say. This is not right. This is not cool. You can't say nothing.
Look where we at. Look where we
I
at.
get it, but how can you say it without saying that? It's along those lines. It's the way you gotta consume stuff for what?
Nutrition.
There you go.
Oh, go ahead, Lisa.
Okay.
You gotta go to the. Better go see that man to make sure you doing right.
God.
You gotta go see. Huh? You gotta go see a physician.
Physician. Primary doctor.
For what though? What you gotta go see a physician for?
Exam.
Yearly.
Physical. Annual physical.
All right.
There you go.
All
I
right.
got more cards.
No more cards.
Okay.
That was good. That was time. Though.
Uh-huh.
Oh, you got. Was that time?
They still had like 5 seconds.
Oh. You want to let?
That's 5 seconds.
Go ahead. Go ahead. Let's see if you got it. Cause
Let's
that'll
see
make.
one more.
That'll
Buzzer
get.
beater. That's the tiebreaker.
Go ahead. This is the tiebreaker.
You get it.
Soda.
Can't say none of them words.
Soda. Starch.
Sugar. Bad for you.
Disease.
Damn, acid.
Soda.
Acid reflux?
Starch.
Acid.
Disease.
I know it is.
Pass out.
Keep going. Soda, starch, disease, diabetes.
Yes.
I know, right?
Oh.
Good job, good job, good job. How we like that? How we like that? That was fun, right? Right? So, yeah. So everybody on the winning team come and pick up a prize. Yeah, you're the winning team. And I'll come collect all the other cards. I think I got all of them. Oh, you got it. Come on, pick a prize. Right here. Just some small things. I usually bring some stuff that kind of represents health in some form or fashion. Not always medical health, but spiritual health, emotional health, creative health. These are eye patches. So you put these in the freezer. And they be eye patches. You want to?
I'm gonna try to win again. I want
You want to win again? These are good. These are ice packs. All right. You put these on your eyes too when you sleep. Yep.
First aid kit.
You got that?
I'm gonna be a grown up.
All right. All right. What you want? You don't know? Okay, which one do you want? This one?
No.
Oh.
Thank you.
All righty.
I need that right now.
Okay.
Yeah, I know that'd be good enough.
All right, next, I need 2 volunteers for 2 scenes. You volunteer? Okay.
I'll come to the front.
Yeah. Let's move that a little bit. And put a chair. That means it's your way. Use it. Okay. You volunteer? Oh, okay. Okay.
Okay, we got the men volunteering. Okay.
Okay. So, as you all heard, I talked a lot about physical health, but also creative health, spiritual health, and emotional health. And my daughter here is a thespian. So we decided to do something a little bit different this time, and we are going to act out a scene. These gentlemen have volunteered to be our patients for the day, and they are going to act out a scene with our doctor or our nurse. Our nurse. She's going to be the nurse, and this is going to kind of demonstrate how to advocate for yourself when things don't seem like you understand or people are listening to you. So we have 2 scenes. So I'm gonna set up for bingo. We'll play bingo after the game. So while I'm setting up for bingo, we can talk and chit chat. She's gonna coach our actors real quick. You got that? Alrighty. Alright. So you have this hand holder. Yes. Have you ever acted before? Okay, cool. So, you don't need no coach. Okay? We just gonna go with the flow. We're gonna do our thing.
Okay,
Do a
so
nice
I'm
little cold
patient.
read.
Okay.
Yep, you'll be the patient. I'll be the nurse. Lift it up. You know what I mean?
Right, yeah, I got it.
Like standardized patient mode.
Okay,
You know what I
okay.
mean? Like that whole kind of thing. Yeah, you can read it over. If you have any questions, let me know.
Okay.
Yeah, I think that's what I'm
Okay.
In some cases.
Yeah, okay.
I
mean, hey, that's excellent.
No, I'm
That's
good.
you
I'm
know.
good.
So this is, I didn't read over the other one. I didn't read over this one. You just kind of like,
I just read over the script.
yeah. Okay.
The nurse, right?
Yeah. So pretty much, I'm going to be spitting a lot of like big words, like very quick things that you know, you don't really get where the kids
So that's what I can do, so.
right. So both of these things are about like advocacy when you're dealing with a nurse in different scenarios. You want to run through it, or you want to?
No, I got it. Let's
Exactly. I get it right the first time. I like that. I like that. One hit or quitter.
Jameelah,
Yes.
can you have them sit right there so I can record
Say
it?
it again.
Can you have them like sit in the middle so I can record them? When they doing the acting.
Oh, sit here?
Yeah, when they're doing the acting so I can see it.
Do you want them to use this here?
Huh?
Want them to use this?
Oh, it'll make a difference. Oh,
You know what I mean?
Okay.
Since it's already a
Mhm.
table and a chair.
yeah.
So it's the scene.
Yeah, this will be the scene right here.
Well, you got it.
Yeah, I'm gonna Oh, should I move it in front?
Yeah, I mean, so everybody can see. So that's why I thought we could use that here.
Oh, I got you. Yeah, I got you. So you want to pull up the chair to the middle, like you did?
Yeah, I can just pull up. Pull up and move everything.
There we go. Alright. Turn towards. Oh, turn towards this.
I left my stuff. Oh, that was all. Okay. It's more in here though. Okay.
All right, you let me know when y'all are ready.
No, I'm
I think
excited.
we're ready. Okay. How we doing?
I think we're ready.
We're ready? Yep. Okay. And I have the discussion question afterwards. Okay. All righty. How we doing? Okay. Oh yeah, we want. Let's stay. I'm gonna stand over here. Come over here. Okay, so these two short scenes are designed to help participants practice advocating for their own health. Each skit includes a realistic situation, expanding dialogue, and we're going to have some follow-up discussions afterwards. Okay? This first scene is called The Tangent Talker, advocating when feeling rushed or dismissed. Action.
So what's going on?
Speak
So
up.
last week I had this fish sandwich, and then my niece came over. She just had a baby, and you know, I started kind of feeling kind of gassy, but I kind of had this sharp pain in my left side. But you know, I just been really stressed.
Okay, well, I'm gonna need you to stay on track here, okay? I have other patients, and I need the actual reason why you're here.
I'm trying to explain. I thought maybe the fish or the stress or something caused the pain.
Right, but I need facts, not your whole life story.
I understand you're busy, but this is really, really important to me. I'm in pain. I'm trying to give you the full picture. I know I can get off track, but let me be clear. The pain started off after eating and it hasn't gone away for days.
Okay, thank you for clarifying.
I'm scared it might be something serious. I don't want to leave anything out.
That makes sense. I appreciate that you're trying to be thorough. Okay, let's go back a step. When did the pain actually start, and how would you describe it now?
It started 3 days ago. It's sharp, it's steady, it gets worse. It gets worse than I eat.
Okay, that helps a lot. Thank you for explaining it like that. We'll get it checked out right away.
And scene. Okay, real quick, general feedback. How did we feel about that? Have we all been in that situation where we were like just rambling and talking and kind of saying a bit too much, but not the right enough, right? You know, not the right too much. So how would you say the patient stood up for his self? Let's say herself. I don't know. Oh.
That may
Oh.
have to take that one out.
Oh.
He identified that he knew that the nurse was in a rush, but he needed to clarify how he felt. What he was feeling.
Yep. Anybody else? What could the nurse have done differently?
Maybe be a little bit more patient.
Mm-hmm.
In terms of just saying, like, I understand, you know, because sometimes too, I'm pretty sure the type of patient, maybe they're probably lonely too. It's probably a mental health situation where they probably don't have nobody to talk to. So, you know, maybe just kind of just tell them like, okay, that's nice, but let's just kind of shift to while we're here. Just kind of like be correcting. We're just doing it in a place of love and grace.
Right.
Yeah.
Mm-hmm.
So the way you say things, you know?
Absolutely.
Yeah, not dismissive of all the details of the story, even if the nurse doesn't think they're relevant. You know, it's making sure that the person feels heard rather than dismissed.
Also, I think, like medical professionals, I see it all the time, but acknowledging that the patients, they're not trained like doctors and nurses are trained to diagnose, so they don't think in the same rational way that we think of it. Like, when we're in pain or uncomfortable, we're speaking from a different point of view. But I know it's hard, but yeah.
And then again, I guess my next question would be, so then as patients, as consumers of the health system, what responsibility do you have to be able to redirect the nurse and get them back on track to what you need?
Continue to speak up for yourself.
Mm-hmm.
You have to say, you know, make sure they understand
what your problem is, what you're feeling, how you feel about it, how it started. Make sure they understand where you're coming from.
Also, noticed even with the patient too, before the patient, I guess, knew the wrongdoing, they kind of acknowledged, like, I know you're busy. So I think also to acknowledging that the nurse's job and role and responsibilities requires a lot. And so I think the fact that they acknowledge and say, okay, that I know that can be frustrating and you're dealing with a lot, but let me redirect and just say what my actual problem is and how can we address it. I thought that could be something we could do.
Yeah, I would say one thing from the nurse's perspective, like skimming through the rambling to be able to find the facts and piece together and shift and pivot what questions you need to ask. You know, I know they can go into the room with a list of things of what I need to do my next step, but being able to kind of put those things together based off of what they're given from the patient.
Yeah. So my background is, my first career was mental health. I worked in mental health for 13 years. So sometimes I'm a lot more graceful than some of my fellow nurses. Not her, she's awesome. This is my boo right here. She is awesome. A lot of people, even though they're in the medical field, you would be surprised at how limited we still are in our education. So we don't have the practice with people who have mental health issues or who have anxiety. You know what I mean? Mental health and medical is separate. I don't know how and why it's separate, but it is a separate entity. So just because you encounter a doctor or a nurse does not mean that they really know how to deal with your other issues outside of what you're there for. Right? The psychological aspect, they may not know how to maneuver through those things. So that's just something to go, for you guys to help you advocate for yourself even more, right? They are human too. They carry stuff around too. We all got to check somebody, right? Leave your stuff at the door. I'm here, right? So that's the other thing I would just leave you guys with. Alrighty.
I got one question for the nurse.
Okay.
Make sure I'm saying this right.
Okay. Alrighty. And now we have our next actor. This next scene is called Medical Jargon Mayhem, Advocating for Clear Instruction.
Okay, so we're sending you home with a script for omeprazole 40 milligram BID, and you need to follow up with GI, gastro, within 5 to 7 days. If you have any rebound symptoms, stop by PPI and go back to your PCP.
PPD, PPG, Give me 1 second, I'm sorry. I didn't catch most of this.
Oh, it's all in your paperwork. You'll be fine. Just follow the instructions and don't eat any spicy foods.
I know you're busy, but I really need to understand this. What is Ozempic or omeprazole? What is that? What is that again?
It's to reduce stomach acid.
Okay, you said something about bed. What does that mean?
That means twice a day. Once in the morning and once in the evening.
Alright, thank you. But GI, what's GI? What do I call? Who do I call for a follow-up?
GI is a stomach doctor, gastroenterologist. Your primary care provider should give you a referral or help you set that up.
I don't have a primary care doctor right now. Can someone here help me get connected?
Yes, we can have case management help you before you leave.
Thank you. Can we write all this down clearly? I don't want to miss anything important.
And
see. Alrighty, any first thoughts?
You need to do the ABC and DFG, and so all those code letters can throw a non-medical person off.
Absolutely.
So they have to remember that they're dealing with just regular folks most of the time.
Yes.
And so to be clear.
Mm-hmm. Anybody else? Just what's your first thoughts? Like even you being in the scene, what's your thoughts about the interaction between this patient and the nurse?
Yeah, the initials get me every time.
Okay.
And I'm like naturally a little sarcastic, so the Ozempic thing is a real
Is it great? I know, right?
Yeah, I love the ad-lib.
I love the ad-lib. We gonna have to get you when we start doing our shows. We gonna have to get you. You got a future actor on your hand right here. A star is born.
No idea.
He ready? You
He ready.
You ready?
Okay.
He's born ready.
I think it happens a lot. It's like being a nurse myself. Sometimes you get caught up in, you know, you're trained to talk this way, and you know what it means. But when you're trying to, say for instance, we're discharging the patient, you're going over discharge instructions, and this is what it says, but they don't. People might not really understand what it means. So you say instead of saying whole time pump inhibitor, you want to say this is just going to ease your stomach so that way when you eat spicy food, you're not getting reflux. You know what I mean?
It's something that they can relate
it's
to,
just something
right?
to think about.
Right. Right. But he did good at asking her to slow down, and saying that I don't understand. Like, how many times have we left a doctor's appointment, emergency room, or any space of urgent care and really left confused? How many people? Raise your hand if you've ever left somewhere more confused than you went in.
I tell you when they tell you it's all on that paper that you don't understand it. I get home and I look at it and I don't know. I don't remember anything that they said or they didn't say.
Yeah. You can always ask for them to circle or highlight things that are important. Right? If you go to the ER, your primary care doctor, please can you highlight or underline, put a star next to what is important? Because I'm not going to go home and read these 15 pages. We know people, when I give them to people, I know they're not going to read them. Right. You know, I know that. I'm not going to read it. I ain't read mine. I got about 2-3 stacks of discharge papers that I ain't read through. So I know that I'm not, people are not going to read it. But this is about how we can advocate for ourselves when we are in these spaces. I love being a nurse. I know Sheree loves being a nurse. But don't put your health in our hands, right? Your body, your health is important to you, your family, your loved ones, right? Walk in there and be clear about who they're taking care of, right? They are taking care of you. Somebody loves you. They're taking care of your mom, your dad, your children, right? One thing I say at work, a lot of times people, get upset because family members are asking questions or, patients are being naggy a little bit. It happens, right? We're human. I'm an angry family member. I tell Sheree that all the time. I am an angry family member. If I take my daughter to the doctors and somebody says something sideways, I'm on trip. Right? My nephew just is battling leukemia for the last 2 years. Thank God he's almost done. I blew up in CHOP, a nurse and all. I blew up because that's who's important to me. That's it. Right? So it is important for us to just know that we don't have jobs without you. We don't. We could be annoyed all we want. We got to keep it in our head. Right? But be clear that you have the power to take care of yourself. Right? You know what you feel. You know what you may need, at least in some direction, know what you need. Right? Whether that's pain relief, whether that's better understanding, whether that's mental health help, right? Whether that's support for how to get, that you don't have primary care, right? How do you get medications? Ask those questions. If they can't answer them, they should be able to give you some sort of direction. Maybe not the full answer, maybe not the whole problem, they can't solve the whole problem, but they can give you some sort of direction. Whether it's a piece of paper that has a list of primary care names on it, right? Whether it's a list of community centers to go to, right? Somebody come in and they homeless and they say they need shelter. I can't get them nowhere, but I can give them a list of homeless shelters in the city, right? That's what advocating for yourself looks like.
I do have a question. This is kind of like an anecdotal experience. My mom was in the hospital, and she, you know, basically she wasn't getting the care that she was supposed to get. And you know, with me kind of being somewhat familiar with the medical field, I was kind of advocating like, okay, why isn't she getting payments? Like, why, like this, that, and the fourth. There was actually the attending nurse. She actually didn't think what me advocating for her. She thought that it was a threat, and so my mom was discharged because of that, because she said that she felt threatened, and like I basically said, like because again I was advocating for her, but she saw that as something different. And then of course at the end of the day, my mom didn't get the care that she needed. So I'm curious to know, like, I understand that's like an extreme one expression, but how do you navigate that? Because I know from experience, I try to advocate, but they thought I was being threatened, which I personally think it's a racial thing.
Report it. That's one thing, you know, I don't know, some of my coworkers might kick me in my behind for it, but report it.
So that's the thing. I think I reported it, and basically it's kind of fall on deaf ears. So I'm wondering.
Well, they don't. So that's the other thing. People think things fall on deaf ears. Reports get to the floor. It get right. Am I lying? No, it gets to where it needs to go. Right. Change in any organizations don't just happen. Right. They just don't happen. But they do get to where they need to go. I've been reported before. I said patient reported me. I was joking. I literally was joking. Anybody who knows me knows that I have never disrespected a patient, like straight out been like this. I really was like being jokeful. I was caught up in the ER. The patient, I think I was supposed to go back to the room. I forgot. And I'm honest. So I went in, I was like, oh my God, I almost forgot about you, but I didn't. Here go what you need. Da, da, da. I'm so sorry. They reported that. Right? I had to take it on the chin because it was true. I didn't mean it that way, but that person didn't take it that way. And because that person was sick and hurting and all of those things. But it came back. So now I had to be mindful of how I move and how I joke and just make sure that people are there. Right? I had to make sure that people are there. In that case, right, there's no real like resolve you could get immediately. However, you reporting that could potentially stop that person from not listening to the next family. Right? And it could be some of those reports can be catalysts for management to make certain changes, whether it's staffing changes, whether it's more trainings, things like that. You know, it is hard because on either side, the medical team are humans too, so they're going to come with all of their human stuff, and all of that human stuff is not always pleasant, it's not always good, it's not always nice, right? Teachers, same way, right? You got some really, really good teachers. You got some really, really horrible teachers. You got really, really good cops. You got really, really horrible cops. Like, these systems are compiled with so many different people and personalities that the only real way to combat it is that when you're mistreated, report it. That's the only thing that I would say. That's your right. They tell you that. That's your right. You have a right as a patient. And so, again, it may not help you immediately, but it may help the next family. I don't know, that nurse may think twice when it comes down the pipeline. She may think twice about her interaction. Maybe not. Right? But at least you've done your part. I don't think that means you stop advocating. I will say, though, as people, we have to check where our own temperature, right? We talk about physical health, spiritual health, emotional health, mental health. When you are in a space like that and you're advocating for a loved one, you are tense. So you could come across tense, right? You could come across angry. Right? It doesn't, I'm not excusing the nurse's behavior by far. But you could come across that way. we have to know that when we're in those situations are very emotional. They're very scary, right? So you do have to kind of figure out how you also want to show up for your family and for yourself, right? Do you want to show up angry and bitter and upset? Because that's not going to get far, because, right, the medical people are human too, so they may combat that. Or do you want to come across loving, caring, and concerned? So, does that make sense?
No, that makes sense. It's a sad reality, but I mean, it is what it is.
Right. You know, what's the old saying? You get more bees with honey, or more flies with, what is it?
More.
What is it?
More flies with honey
Here we go.
than vinegar.
The vinegar, right. So that goes on both ways. Right? You wanna you be nice to the people taking care of you. it goes both ways, and that's what a lot of people on either end don't really understand. This is a team effort, right? You don't shoot your teammate in the foot, right? So, any more questions, concerns, anything we didn't touch on? All right,
A quick question.
Go ahead.
Like for example, in the emergency room, when there's like a tense situation and there's a crisis, like, and I do recognize like nurses and doctors and the team are all human. How much redundancy in the care is there to help protect everybody involved from mistakes or misjudgments or things like that? Am I making any sense? Like, there are multiple, so in the care of a patient in a crisis situation,
right.
What kind of redundancy is there to help kind of offset an outcome like you described, where the needs of the patient weren't met for whatever reason? I don't know if I'm making any sense.
What do you mean by redundancy?
Like people, the professionals checking each other's work and making
so
sure,
how
does
much?
that make sense? Yeah, redundancy in decisions that are being made and in the care of the person.
Honestly, in the ER, it's pretty fly by night, a little bit.
Yeah.
So it's not. I mean, it depends. You can always speak to a doctor. Like, a nurse can't discharge you. So that's clear. Let's be clear.
Yeah.
A nurse can't discharge you. I can't say, I'm gonna discharge you. Y'all go. The doctor has to do that. So if there's ever a time where you feel like something is not being played out correctly, you talk to the doctor. They don't, they may direct you somewhere else depending on what the situation is. But we tend to check each other, right? We move in a way where we are our other hands and eyes. This patient, if I'm in here, then Sheree might hear that my patient in the other room is screaming or something, or needs help. So we kind of like, the ER in particular is like a tag team of stuff. We have our patients, but because we're all moving around all the time, we hear everything else. The healthcare is a tough place to navigate. It is. I'm not going to mince that at all. I don't mince that. It is a tough place to navigate. You just got to be persistent.
I would suggest that if you are in a situation, you can request to speak to a supervisor or
There you go.
or the health supervisor, and speak to them one-on-one, so that maybe they can get, because they haven't worked with you one-on-one, or they have worked with you one-on-one, so they can kind of get like a clearer understanding of what's going on without the emotions behind it, or without whatever drama is going on behind it. They can hear exactly what's going on, and then they can kind of dictate what's going to happen next. Get over the doctor, over the nurse.
That's helpful, knowing that there's a person that is qualified enough to step in and explain it in a different way or help you understand. Yeah. Okay.
I'm just thinking about my last emergency visit, and I know it's nothing you can do about this. It's just how the system is now. You're already feeling bad, and you're going to the emergency room. Getting through security creates a whole nother level of mindset.
Yes.
I'm getting that down. It's like I'm a criminal, but I'm a patient, and I have a problem with that. You
Yeah.
know, but you can't get through the door unless
Yeah.
you go through all these processes.
So yeah, that's a conversation that we do have in the hospital. It's unfortunate because of where we are, honestly. Like every hospital is not operate that way, doesn't have security in that way. But we do know this, the ones that are in the city, Temple in particular. I think Hub is one that has security. Temple. Like I said, one of the hospitals I work at is a high population of addicts and homeless and mental health, so they have to, right? These are spaces like these measures come from real incidents. People have shot guns in hospitals. People have gotten hurt physically in hospitals, especially in those hospitals where traumas are happening. So we take Temple. Temple's it's a trauma 1 hospital. So a lot of people bring gunshot wounds there on foot and EMS, like the ambulance. So they've had families in here like fighting, like robbed, we've been, y'all grew up in the city, y'all heard the stories. So those are but it is unfortunate. It is. I don't know what we can do about that, but it is. It does make you feel a little bit more anxious and uncomfortable.
I was a member of an organization that published a pamphlet called Our Health is Up to Us. And I think you really have to, we as people who are concerned about our community, we have to encourage people to learn as much about themselves as possible. Because when it boils down, it's really up to you. I had an experience the other night that was really popular. I had my cataract removed in CB's a couple of months ago. And I laid down and they were really bothering me. My eyeballs were like beginning to bother me and stuff like that. So I said to myself, this was like 12 o'clock at night. I said to myself, I need to get this checked out. So I got up, put my clothes on, and went down to the emergency room. Lo and behold, wasn't nobody there but me. All the workers were right there ready to help me. So I got good help, and I was saying that to say, we really have to take some responsibility for what happened to us and related to our health, and we can never give up. Just kind of fight that good fight.
Yeah, no, he's absolutely correct, right? One thing we do, we all do it, we wait until it's too late. I have another little joke that I say in the hospital. There's only two real reasons why people come to the emergency room. This is my little joke. I say all the time. It's 2 reasons. Either you're scared or you're impatient. That's the only reason why I'm going. Only when I get scared or when I need something now. That's the only 2 real reasons. So we gotta remember that all of that in between, if you can utilize all of that in between, then you won't be operating in a place of fear or impatience, right? When you go to the doctors every 6 months, 3 months, right? When you're getting your blood work done, when you're going to the dentist, when you're getting your eyes checked, you don't feel that same level of fear. Life is going to happen regardless, right? Our health is going to move the way it moves regardless, right? Some things are going to be inevitable. Let's be clear. Vegans get cancer. Vegans get diabetes, right? Some things are just going to happen. However, in order to live physically healthy, mentally healthy, and spiritually healthy, we gotta kind of get rid of the angst, get rid of the fears, get rid of the uncertainties, right? And that's what pulls us to going to the hospital. So we go to the hospital, my ankle been hurting not 2 days, my ankle been hurting for 6 months. Now I want them to go and fix it right now. You need to tell me right now what's wrong with my ankle. And I've been hurting for 6 months. I probably should have went to my podiatrist 3 months ago. Right? Maybe it wouldn't have got to this 6-month urgency where now I'm at the hospital and I'm waiting for 2 hours and I think that's too long. right? That's what we're talking about with advocating for taking more responsibility for our health care. It doesn't mean not to come, right? It just means what can we do in between those times so that we're not operating in a place of fear and impatience. That we are really taking charge of our health care, right? We're really saying, these are the things that are important to me, right? This year, I've made a vow to take care of my health care. I haven't been. I'm an ER nurse, mom. I rip and run. I work overtime. And I was, like, I'll get there. I finally, in the last 6 months, I got an MRI in my foot because my ankle really been hurting 6 months or more. Like, that wasn't a joke. Right? I got an MRI in my ankle because I don't know why it's hurting this way. I've been going to physical therapy. I finally got to a podiatrist. I have an endocrinology appointment set up because my thyroid levels are all off. I never got that checked out. So now I feel so much better. My problems are not fixed, but I feel so much better. Right? I got an eye appointment. I feel better because things are lining up. At least I have an appointment. I don't know what's going to happen there, but I have it. Right? So, I guess I'm in there. So the end is we own our health. We own our health. That's the mantra for the day. I own my own health care. My health care is in my hands, and health care is physical, spiritual, emotional, psychological health. We own it. All right. Last game we're gonna play is a little bingo. I think Maya's gonna call out. You wanna call out the stuff? Yeah. All right.